Hello, my name is Ashley Parham. This is my public service announcement for children and childhood immunizations for Nursing 444, Spring 2020, Professor Dr. Lucky, Indiana State University. I have included a pre-test on children and childhood immunizations so you can test your knowledge before we start the presentation. The population at risk is children birth to 18 years of age. I have also included a handout on children and childhood immunizations that highlights the learning objectives and content. The learning objectives are: what are childhood immunizations? What are the common childhood immunizations? Why are childhood immunizations important? And what are the risks and benefits of childhood immunizations? The content includes introduction to childhood immunizations, most common childhood immunizations, importance of childhood immunization, ages children should be vaccinated, diseases childhood immunizations protect against, and resources for parents. So you may be asking yourself, what are childhood immunizations? A vaccine is a preventative treatment for certain medical diseases. Vaccines are important because they not only keep your child healthy, they also help all children by limiting the spread of disease. Children in the United States routinely get vaccinated to protect them from more than a dozen diseases. Vaccines help make children immune to serious diseases without getting sick first. Without a vaccine, a child must get the disease in order to become immune to it. And vaccines work best when they are given at certain ages. So, what are the most common childhood vaccinations? The most common childhood vaccinations are the flu vaccine, the DTaP vaccine, the MMR vaccine, the meningococcal vaccine, the pneumococcal vaccine, the varicella vaccine, the HPV vaccine, the polio vaccine, the Hib vaccine, the hepatitis A and B vaccines, and the rotavirus vaccine. So what do all those fancy names mean anyway for these vaccines? So the flu vaccine is available by injection and is given starting at 6 months of age yearly between October and November to prevent against that season's strain of the flu. The DTaP vaccine is 3 vaccines in one shot. It protects against diphtheria, tetanus, and pertussis. This vaccine is given in a series of 5 shots, with the first starting at 2 months of age and the last between ages 4 to 6. Diphtheria attacks the throat and heart and can lead to heart failure and death. Tetanus can lead to severe muscle spasms and death. And pertussis, which is also called whooping cough, causes severe coughing, making it hard to breathe, eat, and drink. It can lead to pneumonia, convulsions, brain damage, and death. The rotavirus. This is a vaccine that protects against the rotavirus. Children receive this at age 2, 4, and 6 months of age. Rotavirus causes diarrhea, vomiting, and fever that can lead to dehydration in babies and young children. The polio vaccine helps protect against polio. Children receive this vaccine 4 times, ranging from 2 months to 6 years of age. Polio can cause muscle pain and paralysis of one or both legs or arms. It may also paralyze the muscles used to breathe and swallow and can lead to death. The MMR vaccine protects against measles, mumps, and rubella. This is a 2-vaccine series, one received at age 1 and the other between the ages of 4 and 6. Measles can cause fever, rash, cough, runny nose, watery eyes, ear infections, and pneumonia. The mumps causes fever, headache, and painful swelling of one or both of the major saliva glands. And mumps can also lead to meningitis. Rubella, also called the German measles, causes a slight fever, rash, and swelling of the glands in the neck. The Hib vaccine helps prevent against Haemophilus influenza type B, which is a leading cause of serious illness in children. It can lead to meningitis, pneumonia, and a severe throat infection. This vaccine is given as a series of 3 or 4 shots from 2 to 15 months of age. The varicella vaccine helps to protect against the chicken pox. This vaccine is given once at 12 months of age and again at ages 4 to 6. The hepatitis A and B vaccines. These vaccines prevent against hepatitis A and B. The hepatitis A vaccine is a series of 2 vaccines given at least 6 months apart between the ages of 12 and 23 months. The hepatitis B vaccine is a series of 3 shots, with the first shot given soon after birth. The meningococcal vaccine prevents against 4 strains of meningitis and is given once between ages 11 and 12. The pneumococcal vaccine helps to prevent against a type of bacteria that is a common cause of ear infections. This bacteria can also cause meningitis and bacteremia. This vaccine is given in 4 doses at 2, 4, 6, and 12 months of age. The HPV vaccine helps to protect against the human papillomavirus, which can cause cervical cancer and genital warts. This vaccine is 2 doses, with the first dose given between 11 to 12 years of age, and then the second dose 6 months later. So let's say you're trying to decide whether you want to vaccinate your child or not. So what are the risks and benefits? The risks are your child could have an allergic reaction to one or all of the vaccines. The immunity to the disease is not necessarily obtained with the vaccination, or there could be side effects of the vaccines. On the other side, the benefits are the immunity is achieved against numerous serious and deadly childhood vaccines. By vaccinating your child, you are not only protecting your child, but also anyone your child comes in contact with. And vaccines prevent the spread and reoccurrence of deadly diseases. There are many resources out there for parents to research and look at before deciding whether you should vaccinate or non-vaccinate your children. Some of those sources are the Centers for Disease Control and Prevention website, the vaccine information sheets that are given to you from your doctor prior to any vaccinations your child receives. Your local health department can give you information, and your pediatrician or your family doctor can give you more information as well. This concludes my presentation, but I have included a post-test on children and childhood immunizations to test your knowledge of what you've learned during the presentation today. Thank you.